Hello Ebony. In this segment we will discuss an overview of the NDIS. Many people are now aware of Australia's new National Disability Insurance Scheme, also known as NDIS, was introduced on the 1st of July 2013. Would you be able to provide us with some background as to its introduction?
For many years, various interest groups have been lobbying the Australian Government to see improvements in disability services across Australia. This lobbying resulted in the Australian Government seeking a report from the Productivity Commission. The Productivity Commission's recommendations and reports can really be seen as the basis for the NDIS. In the lead up to the 2013 federal election, both major political parties showed support for the scheme, and so it was introduced.
Thank you. Why was the NDIS thought to be necessary?
The NDIS was thought to be necessary because the disability support services that were available to people across Australia really varied dependent on where they lived, what disability they had, and how they attained that disability. It's hoped that the NDIS will overcome that inconsistency problem. The NDIS is also thought to be necessary to provide long-term essential care and support to eligible people. So the scheme will look at the desired outcomes for those people over their lifespan and really be able to provide long-term support.
Thank you. The main priority is providing care and support for people with disabilities. How does the NDIS relate to medical treatment and cost of living?
You're right, the emphasis is really on care and support, and that is because the scheme isn't intended to replace services that are currently provided by the government by, say, Medicare or Centrelink. So, for example, medical treatment will still be the task of the public hospital systems, and Centrelink will still provide income support.
The NDIS seeks to achieve significant objectives. How quickly do you feel that people with significant disabilities will be able to access the scheme?
Well, the scheme was introduced on the 1st of July in 2013. However, it initially began in what's been called a launch phase. So this launch phase means that the scheme is only accessible to a certain area and region. So in New South Wales, access to the scheme is restricted currently to just the Hunter local government areas, which encompasses Newcastle, Maitland and Lake Macquarie. The scheme isn't going to be fully rolled out until 2019.
Where are the other launch sites throughout Australia?
In Victoria, the launch sites are the Colac Otway, Geelong, Queenscliff and Surf Coast areas. In South Australia and Tasmania, things have been done a little bit differently, and they've limited access to the scheme to a particular age group instead of a particular region. So in South Australia, access to the scheme for eligible people is restricted for up to the age of 14. And then in Tasmania, the scheme is restricted to people falling between the ages of 15 and 24. In the ACT and the Northern Territory, the scheme won't commence until the 1st of July 2014.
Thank you, Ebony. Aside from providing individuals with care and support, does the NDIS have any other roles and functions?
Yes, the agency has 4 broader roles. The first is to enhance and facilitate innovation in the disability services sector. The second role is to really promote community awareness. The third role is to collect data on the services and supports provided within the scheme. And the fourth role is to really undertake research about the disability services.
Thank you. Once fully operational, how many people will benefit from the NDIS?
At the moment we can only really estimate, but it is said that about 450,000 people would benefit from the scheme once it's fully rolled out.
Ebony, thank you very much for your answers. You've been able to give us a sense of the purpose of the NDIS.
Thanks, Chris.